COVID-19. COVID-19 caused by a novel virus. The coronavirus or SARS-CoV-2 is a respiratory illness that has become a pandemic. This virus was first detected in Hubei province, China. Tens of thousands of people were infected with COVID-19 in many parts of China, as reported by the China's official. Cause of COVID-19 have since then been reported internationally in many countries. Substandard community level or person to person transmission is the cause of the spread of the infection. The reason that COVID-19 is so dangerous is that it can spread thousand droplets or even stay in the air and isolate, making it impossible to detect.
Some of the symptoms of COVID-19. COVID-19 affect different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms: 1. Fever, 2. Dry cough, 3. Tiredness. Less common symptoms: 1. Aches and pains, 2. Sore throat, 3. Diarrhea, 4. Conjunctivitis, 5. Headache, 6. Loss of taste or smell, 7. A rash on skin or discoloration of fingers or toes. Serious symptoms: 1. Difficulty breathing or shortness of breath, 2. Chest pain or pressure, 3. Loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5-6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days.
Prevention and control in COVID-19 pandemic. Here are the measures you need to take keep the virus at bay. First is avoid close contact with people who are sick. Maintain at least 3 feet distance between yourself and anyone who is coughing or sneezing. Second is avoid touching your eyes, nose and mouth. Third is stay home when you are sick. Fourth is cover your cough or sneeze with a tissue, then dispose of the tissue safely. Fifth is clean and disinfect frequently. Touch objects and surfaces using a regular household cleaning spray or wipe. Sixth is wearing a mask is not necessary unless you are taking care of an infected person. The Centers for Disease Control does recommended that only infected people wear masks to prevent the spread of the virus. Seventh is
Wash your hand often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. 8 is, if soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water when hands are visibly dirty. 9th is, if you have a fever, cough, and difficulty breathing, seek medical attention immediately. 10th is, keep in mind the travel advisory set out by the Ministry of Health and Welfare.
How to properly wear a face mask. 1. Wash hands thoroughly before use. 2. Cover nose and mouth with the mask. 3. Securely fasten the earlobes behind your ears. 4. Pull from the bottom to extend coverage from noise through chin. 5. Adjust the nose pair for best comfort. 6. After use, please dispose the mask into the recycling bin.
In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named Covid19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with Covid-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake, if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far: the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.